Did you know your body produces about a liter of mucus every single day? That's right, a whole liter. This might sound a bit gross, but it's completely normal and essential for your well-being. Mucus, a slippery and sometimes sticky substance, acts as your body's natural defense mechanism, protecting you from harmful invaders. It lines your respiratory system, digestive tract, and other delicate areas, trapping dust, bacteria, and allergens before they can cause trouble. Think of it as a sticky trap capturing anything that shouldn't be there. Without mucus, we'd be much more vulnerable to infections and irritations. However, there are times when our bodies produce more mucus than usual, particularly in our throats. This can lead to that uncomfortable feeling of having constant phlegm making us cough and clear our throats repeatedly. Understanding why this happens is crucial for maintaining good respiratory health. By learning about the causes and solutions for excessive phlegm, you can take control of your health and breathe a little easier. While we might not always appreciate its presence, phlegm plays a crucial role in keeping us healthy. This often overlooked substance is more than just an inconvenience. It is a vital part of our body's defense mechanism. It acts as a protective barrier, trapping foreign particles and preventing them from entering our lungs and other vital organs. Imagine it as a sticky shield that captures dust, pollen, and even harmful microorganisms before they can cause any damage. This sticky substance contains antibodies and enzymes that help neutralize harmful bacteria and viruses, preventing infections. These components work together to ensure that our respiratory system remains clear and functional. However, the consistency and color of your phlegm can offer valuable clues about your health. By paying attention to these changes, you can gain insights into what might be happening inside your body. Thin and clear phlegm is generally considered normal, indicating a healthy respiratory system. This type of phlegm is usually produced in small amounts and is a sign that your body is functioning as it should. However, when phlegm becomes thick, sticky, and changes color, it can be a sign that your body is fighting off an infection or reacting to an irritant. This change in consistency and color is your body's way of signaling that something is not quite right. Thick phlegm is often a symptom of an underlying condition, and understanding what causes it is crucial for effective treatment. Whether it's due to a bacterial infection, a viral illness, or an allergic reaction, identifying the root cause is the first step towards recovery. For example, white or yellow phlegm might indicate a cold or sinus infection. These colors suggest that your body is producing more mucus to flush out the pathogens causing the illness, while green or brown phlegm could suggest a more serious bacterial infection. These darker colors are often a sign that your body is dealing with a more severe infection that may require medical intervention. Paying attention to these changes in your phlegm can help you identify potential health issues early on and seek appropriate medical attention if needed. Early detection and treatment can prevent minor issues from becoming major health problems. Ignoring persistent thick phlegm could lead to complications, so it's essential to understand the underlying causes and address them promptly. Chronic respiratory issues can develop if infections are not treated properly, leading to more severe health problems down the line. If you notice persistent changes in your phlegm, consult a healthcare professional. They can provide the necessary tests and treatments to help you recover and maintain your respiratory health. Remember, your body often gives you signals when something is wrong, and phlegm is one of those important indicators. Simple measures like staying hydrated, using a humidifier, and practicing good hygiene can also help manage phlegm production and keep your respiratory system healthy. By taking these steps, you can support your body's natural defenses and reduce the risk of infections. In conclusion, while phlegm might seem like a nuisance, it plays a vital role in protecting your health. By understanding its functions and paying attention to changes, you can take proactive steps to ensure your respiratory system remains in top condition. Thick phlegm occurs when your body produces excess mucus in an attempt to fight off infections or irritants. This mucus is a sticky, gel-like substance that traps pathogens and particles, preventing them from entering your respiratory system. While this is a protective measure, it can sometimes go into overdrive. This increased mucus production is a natural defense mechanism, but it can be uncomfortable and disruptive to daily life. Imagine trying to focus on work or enjoy a meal while constantly feeling the need to clear your throat. It can be quite bothersome and affect your overall quality of life. Imagine your throat as a highway. Normally, mucus flows smoothly, keeping the passage clear. This mucus acts as a lubricant, ensuring that everything from air to food passes through without any issues. It's a delicate balance that your body maintains effortlessly under normal conditions. However, when your body detects an intruder like a virus or allergen, it triggers an inflammatory response. This is your immune system's way of defending you, but it can sometimes be too aggressive. This response increases blood flow to the affected area, causing the mucous membranes to swell and produce more mucus. The increased blood flow brings more immune cells to the site of infection or irritation, but it also leads to swelling and congestion. The result? A traffic jam in your throat with thick, sticky phlegm obstructing the airways. This can make breathing and swallowing difficult and can even affect your voice, making it sound hoarse or raspy. This can lead to a feeling of congestion, difficulty swallowing, and a persistent need to clear your throat. You might find yourself constantly coughing or trying to clear your throat, which can be both annoying and exhausting. Several factors can contribute to the thickening of phlegm. Understanding these factors can help you manage and reduce the symptoms. Dehydration is a common culprit as it reduces the water content in mucus, making it thicker and stickier. Staying hydrated by drinking plenty of fluids can help thin the mucus, making it easier to expel. Allergies, infections, and environmental irritants can also trigger excessive mucus production and lead to that all-too-familiar feeling of a clogged throat. Identifying and avoiding these triggers when possible can significantly reduce your symptoms. For instance, using air purifiers, avoiding smoking, and managing allergies with appropriate medications can make a big difference. Additionally, using a humidifier to add moisture to the air can help keep your mucous membranes hydrated, reducing the thickness of the mucus. Inhaling steam from a bowl of hot water or taking a hot shower can also provide relief by loosening the mucus. Over-the-counter medications, such as expectorants, can help thin the mucus, making it easier to cough up. However, it's always best to consult with a healthcare professional before starting any new medication. Practicing good hygiene, like washing your hands regularly and avoiding close contact with sick individuals, can also help prevent infections that lead to excessive mucus production. By taking these steps, you can help your body maintain a healthy balance and avoid the discomfort of thick phlegm. A wide range of factors can contribute to the production of thick phlegm, and understanding these factors is crucial for managing and alleviating this uncomfortable symptom. Phlegm, a type of mucus produced by the respiratory system, serves an important role in trapping and expelling foreign particles and pathogens. However, when it becomes thick and excessive, it can cause significant discomfort and indicate underlying health issues. Identifying the root cause of thick phlegm is essential for effective treatment. Without pinpointing the exact trigger, it can be challenging to find the right approach to manage and reduce phlegm production. Allergies are a common culprit behind thick phlegm. When the body encounters allergens, it triggers an immune response that leads to inflammation and excess mucus production. This is the body's way of trying to expel the allergens and protect the respiratory system. Allergic reactions can cause the nasal passages and throat to become inflamed, leading to an increase in mucus production. This mucus can become thick and sticky, making it difficult to expel and causing discomfort. When you encounter an allergen, such as pollen, dust mites, or pet dander, your body reacts by releasing histamine and other chemicals. These substances cause your nasal passages and airways to swell and produce more mucus in an attempt to flush out the allergens. Pollen, dust mites, and pet dander are some of the most common allergens that can trigger this response. These tiny particles can easily be inhaled, leading to an allergic reaction and subsequent mucus production. The release of histamine and other chemicals during an allergic reaction causes the nasal passages to become congested and swollen. This congestion can lead to the production of thick phlegm, which can be difficult to clear from the airways. Infections, such as the common cold, are also major contributors to thick phlegm. When the body is fighting off an infection, it produces more mucus to help trap and expel the invading germs. The flu, sinus infections, and bronchitis are other common infections that can lead to increased mucus production. These infections cause inflammation in the respiratory tract, which in turn leads to the production of thick phlegm. Bronchitis in particular is known for causing a persistent cough and the production of thick, sticky phlegm. This condition can be acute or chronic, and managing it often requires medical intervention. Infections often cause inflammation in the respiratory tract, leading to increased mucus production as your body tries to fight off the invading germs. This inflammation can make it difficult to breathe and cause significant discomfort. As your body fights off an infection, it produces more mucus to help trap and expel the germs. This mucus can become thick and difficult to clear, leading to a buildup of phlegm in the airways. The color of your phlegm can sometimes provide clues about the type of infection you have. For example, yellow or green phlegm often suggests a bacterial infection, while clear or white phlegm is more commonly associated with viral infections. Yellow or green phlegm is often a sign that your body is fighting a bacterial infection. This type of phlegm is usually thicker and more difficult to expel than the clear or white phlegm associated with viral infections. Environmental irritants such as smoke, pollution, and dry air can also irritate the airways and trigger excess mucus production. These irritants can inflame the delicate tissues in your throat and lungs, leading to a buildup of thick phlegm. Smoke, pollution, and dry air are common environmental factors that can cause irritation in the respiratory system. This irritation can lead to increased mucus production as your body tries to protect itself from the harmful effects of these irritants. When the airways become inflamed due to environmental irritants, the body responds by producing more mucus. This mucus can become thick and difficult to clear, leading to a buildup of phlegm in the airways. The inflammation caused by environmental irritants can lead to a buildup of thick phlegm in the throat and lungs. This phlegm can cause discomfort and make it difficult to breathe. Thick phlegm can cause significant discomfort and make it difficult to breathe. It can also be a sign of underlying health issues that need to be addressed. By understanding the various factors that can contribute to thick phlegm, you can take steps to avoid triggers and find relief from this uncomfortable symptom. This may involve avoiding allergens, managing infections, and reducing exposure to environmental irritants. Taking steps to avoid triggers and manage underlying health issues can help reduce the production of thick phlegm and improve your overall respiratory health. This may involve using medications, making lifestyle changes, and seeking medical advice when necessary.